Okay, this is a quick video about how to schedule a patient. When you're at the aXium home screen, we're going to click on Scheduler. When we click on Schedule, a map of the clinic that we're working in pops up. And on the bottom part, we can click on the day to navigate to the day that we're interested in reserving a chair. For this example, I'm going to go to, let's say, June the 4th. Okay, so I can see a map of the clinic. If I want to schedule a chair, all I have to do is click on that chair. It'll turn green, showing that I have reserved that chair for that appointment. Now, I'm working in the morning appointments block. As you can see, the time is from 8 to 12, and these morning appointments are actually from 9 to 12. If I click on this time here, you can see that it changes from 1 to 5. Those are the 4-hour afternoon appointment blocks. So I'll click it again to go back to the morning, and I can see my chair, my discipline, and my scheduling group. Sometimes you'll also see the professor's name who is scheduled to cover that chair. Once I've reserved my chairs and I want to schedule a patient for this chair, I'm going to click on the Active tab. Now, before I do that, just one word of caution. All it takes to select and deselect a chair for a particular appointment block is one click. So if I click here, it moves my reservation to the operative chair from the fixed chair. I can click back on the fixed chair. If I click this green again, it will deselect it. Okay, so be careful after you've scheduled a patient if you click on a different chair in that same appointment block, because it will actually change your reservation to the new chair and it will move your patient's appointment to that new chair. So just a word of caution there. So once we've selected the chair we want and it's green, I'm going to choose Active. When I look at Active, I can see yellow bars that signify that I have a reserved chair in that particular spot. So once I see that I've reserved my chair for the time that I want, all I need to do is double click on the yellow bars. This will ask me to select a patient from the rolodex. I'm going to choose myself. If I double click that, a new appointment window will pop up. Okay, the provider is my number. The appointment code is a 3-hour appointment for these morning appointments. It would be 4-hour for afternoon appointments. The treatment discipline in this particular case is fixed pros. Remember your treatment discipline for what chair you clicked when you're coming into the appointment screen. The appointment status is either regular or new. We'll do regular. Most of the appointments are regular. And then a quick reason or a quick note that you'll be able to see from your scheduler that pertains to this particular appointment. So, a crown prep on number 30. Once I've added in all those things, I'll click Accept. Another window is going to pop up. It's going to have me add treatment codes to that particular appointment. So I'll tag the codes with the appointment. So I'll add in a D1110. I'm going to choose the right arrow to add it to the appointment. Once I've done that, I can click Close. Now once the appointment's made, it's just going to float on the top of the aXium screen as a yellow box. I'm going to click it and I'm going to drag it up to the time that it should start, which is 9 o'clock, and double click. When that appointment turns white, it means that the patient has been scheduled. I can see the note that I wrote. It's got the patient's phone number. It's got the code that is supposed to be, the treatment code that's supposed to be done, as well as how long the appointment is. If I click on chair again, I can see once again that I'm scheduled, and that's all there is to it. Now let's say I want to do a partial reserve, for instance, in a DXR chair. I'm going to choose another appointment block, and without clicking anything before I do that, for example, I'm going to choose this to where I have a green chair, and then I'm going to try and partially reserve the DXR chair. If I try and do that, it'll let me get this far, and if I try and do that, it's going to tell me I already have a chair reserved. So make sure that you don't have any green chairs on your screen while you're trying to do a partial reserve. We're just going to right-click the chair you want to partially reserve, choose Reserve Partial Session 4. You can choose the time that you want to do the partial reserve for and choose OK. The chair that I selected turns green, but in this case you'll see a black dash that's only in the top part of this chair. That signifies that the first hour of that 4-hour block is reserved for me, but other students can reserve subsequent hours. Once I do that, I'll go and schedule a patient the same exact way, and then I'll be ready for a partial session in the afternoon and a full session in the morning. See you later.